Hi everyone, my name is Carrie Holloway. I'm the nurse practitioner at Peninsula Plastic Surgery, and today I am joined by Jamie Isett, our physician's assistant. We are here to host the second episode of Hot Topics at Peninsula Plastic Surgery, and today we've decided to talk about lasers. Lasers are best to do in the fall and winter, which is why we thought it would be the perfect time to get into this topic. So when we say lasers, there is literally a laser for everything.
Correct.
So every laser has a specific target. So Jamie, if I came to your practice and I said, I have all of these brown spots, what can I do? Laser for that.
We have a laser for that.
If I came and said, you know, I have mild to moderate rosacea, my face is just always red, what can you do?
Laser for that.
I have severely sun-damaged skin. I have some wrinkles, some aging. What should I do?
Laser for that.
I have an old surgical scar, and it looked really good, but I went out in the sun, and it's looking a little jagged.
Guess what? We have a laser for that.
How about the little red spots, you know, the little blood vessels that surface?
We have a laser for that.
And we also have a laser for laser hair removal. So let's get into it. So this is a perfect example of a patient who came in complaining of sunspots or lentigo, or some patients will call them age spots. So Jamie, tell us a little bit about this treatment.
Okay, so she did intense pulse light. She's a candidate because she has light skin and her pigment is dark. That is ideal when it comes to intense pulse light, because if your pigment is not very dark, the laser doesn't pick it up. So you could be going over that chest 50 million times and it's not going to produce any result. You'll probably end up just burning the patient, and we don't want that. So when I think of dark pigment, IPL is the way to go.
Now, what if I had some of those lighter sunspots?
Lighter sunspots, I would think more good skincare and perhaps a chemical peel to get that chemical exfoliation of the sunspot.
And when we're talking about these brown spots, we think IPL. Our machine is called SRA, but it's the same mechanism. That light is targeted towards that pigment. So this really is the gold standard laser for treating such complaints. Another great example.
So this was a patient that she despised the pigment on her arms. She said it made her look like a grandma. We did 3 treatments, 4 weeks apart, and this was her end result. She was very pleased with that. And again, Carrie, we started it in October because, like Carrie was saying, it's pointless to start anything in the summer because it's like taking 10 steps forward and 20 steps back, because as soon as you go back out into that sun, it's going to come right back.
What type of downtime did this patient have?
So after the treatment, the area is very red, almost looks like a sunburn. The pigment gets darker, but that's a good thing because that's our response. We look for that response to know we delivered a good amount of energy to that spot to produce a response. So we know that something is happening. She was red for about 24 or 48 hours, felt like a little sunburn sensation for maybe the first hour afterwards. I mean, besides the pigment darkening, that's really the only downtime per se, but she's wearing sleeves anyway, and it's cold, and that's really the only downtime. You'll start to notice the exfoliation on the body like 2 to 3 weeks after, versus our face where we have our cellular turnover is a lot quicker on our face. So if we were doing our face, most patients exfoliate that off in 5 to 7 days.
I've had a lot of patients come in and have this treatment, and they can actually go back to work.
Oh yeah, that's
so it's minimal discomfort, minimal pain. Like you said, the spots will get darker.
But that's it. There's no ooey gooiness of the skin. It's not torn open. It's not no blister, no nothing. It's like easy. That.
So moving on to that diffuse redness we talked about. So a lot of times when we think diffuse redness, obviously rosacea, but sometimes this can even happen in patients if they've had a trauma in a certain area. They get kind of those spider veins, and then they tend to get that diffuse redness around it. And this is what happened with this patient here. So we actually did a combination therapy. So tell us a little bit about this.
So with her more prominent telangiectasia or spider veins, you can see around her nose, we hit that with a 1064 YAG. That laser I like to use for those very prominent ones. You can almost just follow that vein down with a 1.5 millimeter spot size. And then as you can see, as you come away on her cheeks, it's more of a diffuse redness. So IPL is great for that diffuse redness, because with the IPL, you can target either vascular or pigment. And in this case, we use the IPL to target the vascular.
And with that being said, so those patients with rosacea who we're treating for diffuse redness, this isn't like a one and done thing.
No.
Rosacea is a chronic problem. So if we're treating a patient for rosacea, we might do a series of 3 to 4, but they're probably coming in every 6 months to at least once a year.
Absolutely, to kind of keep that condition at bay.
This is one of my favorites.
This is a good one.
So going back to that idea of combination therapy, this is a patient who was dissatisfied, I believe, with her scars and her pigment. So Jamie did a great treatment using 2 different hand pieces on the same laser. So tell us a little bit about this.
So we used IPL to treat the dark pigment around her cheek area. She only did 1 treatment of the IPL because it produced such a beautiful response when she came back. I anticipated having to treat her again for the pigment, but it looked great. And then we followed it right up with the sublative, which is a laser that pokes little microscopic holes into your skin. Your body's response is, ooh, being injured, so start stimulating fibroblasts, which in turn stimulates collagen and elastin. And for somebody with acne scarring like that, you need at least 4 treatments, at least, and you could probably keep going. But I would say realistically, it can produce, I don't know, make it 70% better.
Yeah, if you keep up with the serious I will say, so this is great. The little teeny holes you were referring to, it's actually radio frequency, which is great for bringing in exactly what Jamie said, that new collagen and elastin, and really helping to improve the overall health of the skin. So this can help with stretch marks, scarring, anti-aging. It's great for a lot of different areas of concern.
And I've had great results with the striae or
the stretch marks on the body. So this isn't just something that we do on the face.
No. And again, when you're treating stretch marks, that ideal stretch mark is the pink. They're the pink ones, not the white ones that are already kind of been there for years. The ones that are kind of newer, the pink ones, they have that texture to them.
Better response. Those are perfect for treating. Now, I will say with the sublative, it's still not really downtime, but it's a little bit more obvious that you've had a treatment. So this is a great Friday treatment. So you come in on a Friday or even a Thursday. The next day, you might be a little dry. The third day, sometimes you do see that grid-like pattern.
You will wake up with that.
By Monday, you're wearing makeup and you're good to go.
Oh, yeah. And I can tell my patients the next day, you can totally throw that makeup on.
So this is actually a third hand piece that is on that ELOS laser that we keep referring to, that has the SRA, the IPL, the sublative. It also has the sublime treatment, which is bulk heating. So think of this as the red carpet treatment. This is great to have done before an event, like a wedding or a reunion. Of course, we're not doing many of those right now, but one day when things are normal, this would be a great treatment before an event. And that bulk heating does the same thing as the sublative. Over time, it's going to break down and help stimulate that new collagen and elastin and really help to tighten the skin. This is something, if you really want to see that long-term result, you're definitely going to want a package of these.
Absolutely. It's like maintenance for your car. You know, we need maintenance all year round for our car. You know, when we stop doing it, then age takes over, you know, and we're trying to combat that.
And one of our most favorite. So this is actually, we call the Trinity treatment. So it's a combination of all of those hand pieces we discussed. So it takes care of the pigment, the texture, and it gives us a little bit of extra skin tightening. So I think this is a great result. This is one treatment. So I don't expect to see a wow, but with a series of these, you would definitely see more of an improvement in that nasolabial fold.
Correct. And even like her pore size, the overall texture, even the wrinkling in her forehead, like these are all things I look at when somebody comes in.
Absolutely.
That makes my eye.
So moving on to a little bit more of an aggressive treatment, we also have the CO2 laser. So when I think CO2, I really think kind of the big guns. It's really the gold standard for those peri-oral lines. Some patients will refer to them as smoker lines or their laughing lines. But it's definitely a little bit more involved than some of our other lasers. It's serious, but it yields serious results.
Absolutely.
So this is a great example of a patient. She really dislikes those fine lines around her mouth. She had one treatment of the CO2 laser. This does involve some skin prep prior to the laser. We want to make sure that it penetrates the skin evenly, that you're getting a good response. It requires skincare after the procedure to make sure that you heal correctly, that you don't have any complications. And it's about anywhere from 12 to 14 days of downtime. The first 5 to 7 days, you're open, you're ooey gooey, you're a little bit crusty, and then the skin heals and it's more of that dry pinkness to the skin. Patients don't describe this as painful. They describe it as uncomfortable. So think of the time when you got that really bad sunburn on your back and all you want to do is go to sleep, but you just can't get comfortable because it's uncomfortable. It's not painful. This is another example of a patient. She actually had full face CO2. Now with this treatment, on the left side of the screen, you'll see her at baseline. On the right side of the screen, this is actually 3 months follow-up. So we don't expect an instant result.
No.
Of course, immediately after, it's going to look good because it's swollen. So you automatically get rid of some of those lines. And then the swelling goes away and the patient's like, oh yeah, it's a little bit better. And then 3 weeks, they're like, okay. 3 months, they're like, oh. 6 months, they're like, wow. And the results of this laser really last anywhere from 1 to 5 years. 1 year is the patient we never see again. They're out in the sun, they're not using their sunscreen, aging takes over. 5 years is the patient who keeps up with their skincare, they're coming in to see the esthetician, they're stimulating their skin, either maybe they're coming in for a sublative, or they're at least staying on some type of retinol to keep those skin cells firing.
And Carrie, you reminded me, so with the sublative, you know, patients will do a series of 4 weeks apart, and they will see improvement of their pore size, of the texture. However, their optimal result is actually 3 to 6 months after their last treatment, because stimulating that collagen elastin, it's a process.
That's a good point. I'm glad you said that.
Yeah.
So moving back to another laser, we're going to go into a little bit more detail about veins. So we're talking about the spider veins on the legs. People can get these anywhere. But Jamie, you actually have a unique combination therapy. A lot of times you'll start with sclerotherapy, and then you might clean up with the laser. Can you tell us a little bit about that?
So obviously the gold standard for leg veins is sclerotherapy. And initially, I typically do that to all my patients because what you see is like this on the screen. I would start off with sclero with that because those veins are nice, they're big, I can fit my needle into them. And then I'll have them come back in about 6 to 8 weeks after that. And I may do another sclero treatment, or typically after a sclero treatment, the veins are finer. And so I'll kind of clean it up with that 1064 YAG and really not even have to inject them again with the hypertonic saline. Now, the veins that we do not treat are those varicose or bulging veins. A lot of times, if I have a patient who comes in like that, I will send them to a vein specialist for them to get those treated first, and then I'll come back behind it and clean up the little telangiectasia on the legs, because ultimately those bigger veins are feeding the smaller veins, and it's like taking 10 steps forward again and 20 steps back, because as long as you have that varicosity, it's just going to keep feeding.
That's a good point. So again, another laser. We've covered our ELOS, which does all the things. We've covered our YAG, which does the vascular lesions, and something else that we'll get into. We've covered the CO2 laser, and now we have the KTP laser. And the KTP laser really is one of those lasers, it's kind of like the jack of all trades. It doesn't have one specific target. It kind of goes for a couple different things. So this is an example of a patient who had DPN. We actually treated with the KTP laser, and you can see she had a great result. This laser can also be useful in treating those seborrheic keratosis, kind of those rough waxy lesions.
The barnacles.
You may need a couple treatments to really knock them out. There's always a risk that they could come back. It's great for angiomas, the teeny tiny little blood vessels, not the ones that are spread out like we were just talking about, but really those hemangiomas, those little spots. The KTP is great for that. And then of course, if you just have a couple little brown spots, the KTP can also clean that up as well. Again, with any laser, you usually require a series of treatments. And then going back to that YAG that we talked about for the veins, it actually has another setting that we use for laser hair removal. So I'll let you talk a little bit about that.
Yes, okay. So with laser hair removal, you know, we have two different lasers. We have a 755 wavelength and we have a 1064 wavelength. Now, for Carrie and I, you know, I would use the 755 wavelength. But the beauty of the 1064 is that wavelength allows us to treat patients of darker skin tone. Because remember, like I said earlier, when you think of lasers, that ideal candidate has light skin and either dark hair or dark pigment, depending on what you're treating. So the beauty of that 1064 is to allow us to be able to treat patients of color laser hair removal. Because they hate their hair as much as we hate ours. So it's a perfect laser for that. And again, because they are darker skin, we always do a test spot before. I have them come back a week later just to make sure their skin doesn't hyperpigment. Because when it comes to darker skin, you have to be very careful when it comes to lasers.
Absolutely. But what if your hair is light and the laser won't get it?
Girl, we need to invent that laser so we become millionaires. You could do dermaplaning.
I love dermaplaning. This is actually one of my favorite spa services because afterwards I just feel like you have baby skin.
And it's literally like a mechanical exfoliation of the skin.
And your makeup sits better, your products absorb better. So this is a great option for that patient that comes in and they're like, I don't know, I just feel like I have peach fuzz everywhere. Dermaplaning it is.
Absolutely. And again, Carrie, contrary to popular belief, it doesn't grow back thicker, darker.
Oh no, because this is Bella's hair we're talking about.
Hair.
It's going to grow back the exact same way as it was before. We hope you enjoyed our laser overview. We are happy to answer any questions you have. If you want to comment below, we'll be happy to get back to you. You can always call our office for a consult. We'd be happy to meet you. And thank you so much for joining us today.
Absolutely. Stay safe.
Yeah, stay safe.